Hello everyone, welcome to our channel. Remember COVID-19? That uninvited guest who overstayed their welcome? We've tossed the masks and ditched the social distancing, but COVID might have left a parting gift, a potential increase in dementia risk, especially for those over 60. It seems this virus has a flair for the dramatic, impacting brain health long after the initial infection fades. Scientists are working tirelessly to understand this link, but one thing is clear. COVID-19's story isn't over yet. Think of it like this. Our brains are like finely tuned machines. COVID-19, being the rude intruder it is, can sometimes throw a wrench into the works. This disruption might increase the risk of developing dementia, a group of conditions affecting memory, thinking, and social abilities. It's a sobering thought, but understanding the potential link is the first step towards protecting ourselves and our loved ones. Dementia is a complex puzzle, with many factors contributing to its development. Age is a big one. Like a vintage car, our brains can become a bit more susceptible to wear and tear over time. Genetics plays a role too, as do lifestyle choices and overall health. Now, COVID-19 has thrown its hat into the ring, potentially adding another piece to this intricate puzzle. While the exact connection between COVID-19 and dementia is still being investigated, scientists believe that the virus's penchant for inflammation might be a key player. Inflammation is the body's natural defense mechanism, but sometimes it can go a bit overboard, causing damage to healthy cells and tissues, including those in the brain. This inflammation might be one way COVID-19 increases the risk of dementia, particularly in older adults who are already more vulnerable. To unravel this complex relationship, researchers embarked on a scientific quest, reviewing numerous studies that explored the long-term effects of COVID-19 on brain health. Think of it like detective work, piecing together clues from different sources to get a clearer picture of what's really going on. This particular study focused on older adults, those over the age of 60 who had contracted COVID-19. The researchers meticulously analyzed data from these studies, comparing the risk of developing dementia in those who had COVID-19 to those who hadn't. They also considered other factors that could influence dementia risk, like age, sex, and overall health, to ensure a fair comparison. Striking findings, a closer look. The results of this scientific investigation were quite revealing. The study found that older adults who had COVID-19 might have a slightly higher risk of developing dementia, particularly within a year of having the virus. It's like COVID-19 throws a little tantrum in the brain, and sometimes the effects linger. Interestingly, the risk of dementia seemed to be higher in women who had COVID-19 compared to men. Why this is the case is still a mystery, but it highlights the importance of considering sex differences in health research. Additionally, the severity of COVID-19 seemed to play a role, with more severe cases linked to a higher risk of dementia. This suggests that the more havoc COVID-19 wreaks on the body, the greater the potential impact on the brain. The path forward, research and vigilance. While these findings are certainly noteworthy, it's important to remember that this is an ongoing investigation. More research is needed to confirm these findings and determine the exact mechanisms by which COVID-19 might contribute to dementia. It's like we've only just begun to scratch the surface of this complex issue. In the meantime, knowledge is power. Being aware of the potential link between COVID-19 and dementia allows us to make informed decisions about our health and seek early intervention if necessary. Regular checkups, a healthy lifestyle, and staying engaged in mentally stimulating activities are all excellent ways to support brain health as we age. Laughter is the best medicine, except when it's not. Speaking of staying engaged, laughter is often touted as the best medicine. And while it might not cure COVID-19 or dementia, a good chuckle can certainly lift our spirits and reduce stress, both of which are beneficial for brain health. So, go ahead and watch that funny cat video. Your brain will thank you for it. But in all seriousness, the potential link between COVID-19 and dementia is a reminder that our health is precious. Let's continue to support scientific research, prioritize our well-being, and approach this new chapter with a healthy dose of caution and a dash of humor. Thank you for watching. Please subscribe for more new updates on health.